Good morning, good afternoon. Welcome to everyone. This is Wahida Shabazel, PWM USA Regional Organizing Director. We want to thank you for coming on to this webinar today, Building and Mapping Campaigns Using Strategy Charts. And I see a lot of you here in the chat box. Can you please let me know if the sound quality is okay? Are you all able to hear me? Because I know everybody's in. Thank you. Great. Okay. So we're going to get started in just about another minute. And thank you all for coming on. So again, I want to thank you all for joining us. This is Wahida Shabazel. I'm the Regional Organizing Director for PWM USA, Positive Women's Network, United States of America. And we're going to get started. And I know Sherry says she's not hearing anything. Sherry, are you hearing us now? Great. Okay, so we're going to go ahead and get started. And again, this is the fourth in a series from the Regional Organizing Work Group of campaign development webinar trainings. We started in January. We did one in January around the PWM priorities using a gender lens and a human rights lens. We went into February talking about campaigning at any level of disclosure. In March, we talked about using a checklist to choose a good issue. And today we're going to talk about mapping and building our campaigns using strategy charts. So we're trying to give you all tools by which you can apply the information that we're giving you so that you all know this webinar is being recorded, and everyone is on this webinar will be receiving a copy of this presentation. Please feel free to use the chat boxes, if you have any questions as we go along. We'll also be opening up the line shortly in the event that you want to state your question verbally. So we're just going to get started. And the goals for this webinar are that participants will gain a better understanding of our PWN policy agenda. You all will understand how to utilize our PWN fact sheets and other resources in campaign development. And participants will learn to map and plan campaigns using a strategy chart. Great. So PWN, we have some strategies. We actually have 4 strategies, and they all connect with our 4 work groups. We strategize around eliminating stigma through our communications work group. We build leadership through our leadership development and training work group. We mobilize advocates through our regional organizing leadership development work group, and we change policy through our policy work group. So our strategies are designed to empower women living with HIV, and we want to change systems. Our policy group is designed to not just help the individual, but to help the community, because we're talking about changing systems or fixing broken systems. So we're talking about systemic change. So we're trying to do big things. So our PWN USA policy agenda, it includes ending HIV criminalization, achieving economic justice, securing women-centered care, promoting HIV prevention justice, achieving reproductive justice for women living with HIV, and ending violence against women living with HIV and addressing trauma. These are the 6 overall policy areas that PWN that we want to change policy in these areas. Any campaign in any of these areas could look like what it needs to look like for the region where you're living. But if you're making campaigns, and we encourage every region and all members to develop and build campaigns, build them under one of these specific areas, so the PWN can give you the technical assistance that you need and support you in your campaign planning. Great. So even though we have strategies, we have to have methods behind the strategy. So our method for changing policy, which we're talking about campaign planning, so we're definitely talking about policy. We're definitely talking about that policy work group. And our method for changing campaign, before we talk about the method, a simple definition for method is just a careful, organized plan that controls the way something is done. So we have a few ways our methods for changing campaigns, and one is to identify the key issues affecting women living with HIV. And although PWN works on 6 specific issues, we know there are many more issues, but we did identify these issues from speaking with our constituency, you all, from surveys, from listening calls. We've identified those 6 as the major ones, so that's what we do. We identify key issues affecting women living with HIV. We ensure meaningful participation of women living with HIV in discussions of those issues. And we conduct we adopt community-based participatory research to inform our advocacy, such as our Ryan White research study that we did recently. And then we make recommendations based on lived experiences of women living with HIV on how we can change these policies. So this is our method. Our strategy, again, is to eliminate stigma, build leadership, mobilize advocates, and change policy. Our method for changing policy is identifying the key issues, ensuring MEPA, ensuring meaningful involvement of people living with HIV, conducting original community-based research to inform our advocacy, and to make recommendations based on lived experiences of women living with HIV. Great. So fact sheets we have on our website, which you can see the website at the bottom. We have fact sheets for each policy issue area that we work on as an organization. And a fact sheet is an easy to understand presentation of data. It's generally 1 or 2 pages long, so it's really handy. Fact sheets are available as printable documents. They can be handed out at community events. If you go onto our website and you go onto a fact sheet, you go onto our website, you go on the resource, or if you just go right directly to use this link, you will see in the left-hand corner, it'll say PDF. PDF means you can have a printable version of the fact sheet. This version can be used as handouts at community events or public meetings, and regional chapters and members can use these fact sheets to help develop talking points and to think about planning your campaigns. So our PWN USA, we apply a gender human rights lens to the HIV epidemic to ensure laws, programs fit the realities of women's lives and our lived experiences. So as you read over these fact sheets, you will see that it is definitely coming from a human rights perspective and it's coming from a gender lens. Does this fit the realities of women's lives? So we've created these fact sheets for you all to use in your advocacy as handouts when you're tabling, as handouts when you're called out to speak at any event. And another thing about our fact sheets is that they identify specific problems, and I just said this, and the impact that it has on women living with HIV. So that's what's unique about PWM's fact sheets, that they identify a specific problem and the impact that it has on women living with HIV. And so the frame is, why is it a priority for women living with HIV? We frame it. Why this particular concern is a problem for women living with HIV? And then we provide recommendations for policy change. So it's a very comprehensive tool, and we hope that you all will be visiting, or I know you already use them, but I hope you continue to use them and continue to send other women to our website to utilize these fact sheets. So we pretty much have all we need. And you may hear me say this all the time. We are who we have been waiting for. I know many of us are watching the war, Wilhelmina's War. We've been watching that, and we some of us saw it at the summit in 2014. And I remember at the end of that documentary, Miss Wilhelmina said, "No one's coming to save us. So I guess we'll have to do it ourselves." And so we are who we have been waiting for. We have everything we need to make change and to make change for our communities and improve the quality of our lives. We have women, we have groups of women who are willing to strategize and plan. We have our website with our policy agendas. We have fact sheets that we just talked about. And today we're going to introduce you or reinforce your learning curve. For some of you may already know about using strategy charts for planning campaigns. But today we're going to offer you another tool to help develop your campaign and to help to map it out. And we call that a strategy chart. So what you see in front of you right about now is a strategy chart adapted from the Midwestern Academy for Social Change. And I know this is an awful lot, but we're going to go through this webinar because this is a training. We will go through each of these columns with you so you can get a better understanding of why it's set up this way. And after you choose the issue that you want to work on, after you select the campaign you're going to work on, then you're going to start filling out this chart as a guide for developing your strategy. You're going to be as specific as you can. You're going to list all the possibilities. And so in the event a new person comes into the room, they won't be so lost. You know, if you had this, as some people learn by visuals, you know, and so some of us may be more experienced than others, but remember, you know, we're all sharing our skills and ability and capacity of women living with HIV. So to have a tangible tool in the room is going to be very helpful in the event that the leaders of the particular chapter or group may not be available. This strategy chart is a group effort, and it gives you the opportunity to define victory, what victory means to you. It gives you the opportunity to evaluate your campaign, you know, and it gives you an opportunity to chart your course. So a successful campaign strategy lays down all the basics, and then you started adding more and more details. So this is going to become a very specific document. So as you look at the 6 categories, the first one is goals, and as I said, we're going to go over each of these columns. But your goals are just what that says. But you're going to list your goals in terms of long-term, short-term, and medium-term goals. Because again, like I was saying, because you can determine what victory is to you. So whereas we may not ever get what we may not get what we're asking for as our long-term goal, but if you set short-term goals and mid-term goals, you'll have a way to evaluate your own victory, because sometimes you win milestones, you win along the way, you win some things along the way. which leads us to our second category, which is organizational considerations. So as we're building campaigns, we want to consider not just what we want overall, but how is our organization going to benefit from this campaign, and even on a personal level, how is our specific group going to, what benefits will this campaign provide to our specific group? So we're going to do a pretty much an inventory of what we have on hand. Sometimes we have more than we give ourselves credit for, what we don't have, and what do we need to actually run this campaign. Our third column, which is in yellow, we're going to identify what are constituents, or who are constituents, who are allies, who can be allies, and who are our possible opponents. Because for any given issue you work on, you may have some people who oppose your liberty. We live in a country where people oppose liberties and human rights for lots of communities. So we move to our next column. We're going to identify who our targets are. Who is this campaign directed at? Who has the power to give us what we're asking for in our first column? We set a goal, a long-term goal. Who has the power to give us that, right? What power do we have over that person, right? So that's what the red column is for. And then the gray column is something that we adapted because PWN, if you know us well, you know we're good on messaging. And messaging is everything, because sometimes it doesn't. My mother used to always say, it's not what you ask for, it's how you ask for it. So PWN is big on saying precisely what we mean, and creating our own press and creating our own media. So we want you all to think in terms of, as you're developing campaigns, it's going to be just as important to develop a media strategy as you go along, and not as a second thought or afterthought or the last thing that you do. So we're going to talk about that column as well. And then the last column is going to be our tactics, which is a part of our strategy. And our tactics is just going to be a way for us to show that the group has power, or to make our power felt. So those tactics are going to have to be in content with whatever you're asking for in your goals. It's going to have to be in content with specifically for whatever target, whoever the decision maker is that you're asking to sign this bill or to make this project or this law a reality. So your tactics are going to have to be exciting. They're going to have to be flexible. They're going to have to be something that the entire group agrees on, and backed by some specific form of power. So again, if anyone has questions, if you put them in the chat box, myself, two other staff people were here today. I should have said that. Arnita Rogers, our policy rep, and Nana Kana, our executive director, and who also manages the policy work group. For those together, they're both on this call. And if there's a question that you have, we're certainly going to try to get an answer if you place it in the chat box. Thank you. So we're going to move to going a little deeper into these columns and what they could look like. And let's talk about HIV criminalization, which is one of PWN's top policy priorities. So here's a sample. If the campaign you select in your state is to end HIV criminalization, if that is the goal, then let's look at what a long-term, a mid-term, and a short-term goal could be for this campaign. In 2 to 3 years, you want to see HIV criminalization laws repealed in your state. We know that's going to be the overall goal because we want to end HIV criminalization. So in a year, you want to be able to build a coalition of supporters, right? To engage, you want to be able to engage stakeholders, other people living with HIV. You want to be able to educate, You want to be able to educate people living with HIV. You want to be able to educate the court systems. You want to educate the district attorneys. In some cases, you may have to educate the public defenders, because and oftentimes it may be public defenders who are defending these people who are facing criminal charges for HIV criminalization. And then a short-term goal could be something you could do in the next 30, 60, 90 days, because you want to do something, right? You're going to have this campaign. So think about in a couple of months, maybe you can assess the laws, get to know what the laws are in your state and the impact those laws have. And that determines who needs to be at the table. That determines, let's define the stakeholders, what coalitions you may have to build. And and you make a plan to target getting your collaborators. You want to build partnerships, and you want to build support for your campaign. That could be a short-term goal. A short-term goal could be just walking around a specific building. If you're going to meet with head of city council, or you're going to meet with some city official, a short-term goal could just be to walk around the building and know where the exits are of the building. Once the strategy chart's been filled out, then the group can start to discuss what those first steps are going to be. But your short-term goal is generally going to be some of the first steps. And after that, it will just sort of flow. And the groups, after the short-term goal, after that, it will sort of flow. So at this point, the group is doing what we call launching a campaign. Once you start to work, someone asked me the other day, we were at a training in Baton Rouge, Louisiana, and they were concerned about the word launching. What does that mean? If you use this strategy chart, if you decide that you're going to work on a issue-based campaign, which means you bring the answer to the table, not just the problem. You're bringing PWM's recommendations, maybe from our fact sheets, to the table, and you establish some long-term, mid-term, and short-term goals, and you start working those short-term goals. In essence, you are launching a campaign. Great. Okay, so that was our first column. Our second column talks about organizational considerations. Okay, so this strategy chart has a column where you write down what resources that you have and what you need to win your campaign. It's important to take a serious look at this column so that you can plan and utilize what you have and get what you need, right? It's also a place for you to write down what you want to get out of the campaign. So this is a very important question to consider. It has to do with your organization. What will your organization get out of winning this issue? For example, it may get more members. It may get more adults. It may get more young people. It may get more community support, right? But you're going to take an inventory of your group's resources. What expertises do you have amongst your group, right? Do you have a place to meet? Do you have access to internet? Are you paying for that stuff, or are those in-kind donations? How are you printing out your information? Is someone allowing you to use their printer, right? So these are the considerations. You want to do your organizational considerations, and then you want to do your both internal and external goals. So you know your external goal, again, is to end HIV criminalization. But what about your internal goals, right? How will this strengthen your chapter? How will this strengthen your organization? You're going to get the logo out there. You're going to become more visible in the community. Your members of your group are going to gain some experience, more experience about the issue topic. They're going to start collaborating with other social groups, not social groups, but social organizing groups. They're going to begin to collaborate and partner with other groups that work on social issues. And at some point, you may hope that you may have about, at the end of this campaign, if you're going to run it for a year or 2 years or 3 years, you're hoping to come away with between 4 to 8 to maybe even a dozen new members, depending on how long you're going to run this campaign. So as you look at your organizational considerations, remember that, and as you build the budget, you're going to have to create a budget, and that budget's going to have to include things like transportation, stamps, envelopes. If you may need cardboard posters, you may need a banner, you may need T-shirts in order to make fun. You may need fundraising materials. T-shirts and buttons can help you replenish your funding. You may need buses if you want to take people to rallies. So these are the sort of things you want to do when you're looking at this column when it talks about organizational considerations. Great. So we're going to move on to the next column, which is defining constituents, allies, and opponents. So constituents, and someone can put it in the chat box if you all know what a constituent is, because at some point we're going to do an exercise. I should have told you all that. Very shortly we're going to do an exercise out of the chat box. So if anybody can put in the chat box who are constituents, because I know we use that term a lot, and it simply means that the people living with HIV. You know, I know that we are a group that works specifically on women's issues, but what we do is still benefits our entire community. So constituents are people living with HIV, right? And some other possible allies could be family members of people living with HIV. If you have law centers, whether they're community-based law centers or HIV-specific law centers, women's health groups, repo rights groups, LGBT groups, students, medical providers, and again, public defenders, right? So as we begin to define who our constituents are, who this impacts, right? We also define who our allies are, who we need to bring to the table, who is going to support us in ending HIV criminalization in our state. So it may be some of these sort of groups, possible allies. But then you also, like I said, this has to be, this strategy chart gives you the opportunity to be very, very specific and to think things through. And so you want to also look at who could be your opponents. So I need to say the strategy chart, it may be done in a group all in one day, an hour or so, or it may be done in smaller groups. Each group could take a column and work on a column, and then you put it all together. You know, it doesn't have to be done overnight, but it's going to be. You're going to start off with. It's going to become very detailed. You're going to start off with this basic information, and as you continue to revisit this document every time you meet, you're going to see it grow. And just to say, as another thing in your goals, one of your goals, short-term goals, could be establishing a regular meeting just for campaign development. You know, because this topic becomes, we know it's going to be an agenda item, but at some point it takes a life of its own, and developing a campaign may need a meeting just for campaign development. So that could also be one of your short-term goals in the first column, is establishing that regular meeting time. But back to this column, as far as defining your constituents, allies, and opponents. Your opponents, possible opponents, could be judges. It could be district attorneys, the criminal justice system. It could be some service providers. It could be faith groups. It could be people living with HIV. It could be law enforcement, the police on the street. So some people living with HIV, we have a lot of community education to do, and we talked about that as our midterm goal, educating X, Y, and Z. Some people living with HIV may not understand the dynamics of ending HIV criminalization because they may still be feeling the burn from being from someone passing HIV along to them, passing HIV on to them. And that's something that you can't dismiss because it is the elephant in the room. And so you're going to have to talk about restorative justice and how does that person how do those people become allies with you as opposed to opponents? And one way you do it is talking about restorative justice, and that could look like whatever it needs to look like in your region. It may look like a mediated conversation between the two persons, alleged persons, right? It could look different ways, but that is something that we're going to have to acknowledge, that sometimes if you're working on HIV criminalization specifically, some of your opponents may be people living with HIV. And when you look at your opponents, you want to ask these kind of questions. What will your victory cost them? What will they do or spend to oppose you? How strong are they? Right? So when we talk about making this strategy chart as specific as possible, so those are some of the questions you may want to ask when you're on this column. And Arnita, I want to thank you so much. I see you helping with the questions in the chat box. I deeply appreciate that. This is a lot of information to give out, to distribute, and I'm realizing some people, this may be new to them, so I'm really trying to take my time and make sure people are getting the gist of, or getting the basic of this information we're trying to share with them. So our next column is the column where we identify our target. Now, you can have primary targets and secondary targets, and let me tell you what I mean by targets. I'm talking about a person who has the power to give you what you want, what you put in your first column, wherever your goal is. Your primary target is the person who has the power to give you what you want. It's always a person. It's never an institution or an elected body. You can't say it's City Hall. You can't say it's the school district. You have to say it's the CEO James Smith of the school district. The primary but there has to be a primary. There has to be a person that you're taking your demands to. Okay, so a person has the power to give you what you want. And then here's some other questions you want to ask yourself. Who has power? Who has the power to give you what you want? And what power do we have over them? Is it electoral power? Do we have the power? In fact, we have the power to put people in office who think like us and who will support our causes, right? So when people are running for office, it's very easy to approach people running for office and be able to ask them questions when they're running for office, because they're very, very much out in the public. And one of those questions could be about, how do you feel about HIV criminalization for non-disclosure? So yeah. And so then there's also sometimes in some campaigns you may have a secondary target. And that secondary target is the person who has power over the primary target. The person who has the power over the person who has the power to give you what you want. So sometimes, again, this strategy chart needs to be very specific. So if you're talking about if you run a local campaign, your primary target for criminalization will probably be the district attorney or some judges. But then if you're talking about running a statewide campaign, where the governor would have power over those persons. And these people are elected officials. So don't forget the power that we have as a community. And we let elected officials know that we do have that power. And then the last column, but certainly not the least important column. I'm sorry, this is not the last column. This is a very important column, which is our media communication strategy. Planning our media communications along with our campaign, not afterwards, right? How are we going to reach the people we want to reach to be our supporters? How do we plan on getting our message to the target, right? So there's many kinds of media we can use, from mainstream media, television, printed papers, to we can create our own media through blogging. We can create our own media through training spokespersons, right? And when we're using our blogging or our spokespersons, we're using sound bites, something that we're saying over and over and over again. HIV criminalization is harmful. It undermines public health, all the public health messages, recommendations to getting tested. It undermines people getting tested. It puts undue responsibility for the safety completely on the person living with HIV. So, yeah, and you could communicate these sound bites through Twitter chat, through newsletters. You can make T-shirts. How they say, watered. How some people say, wrote the book, turned the page, wore the T-shirt. Right. So even your messaging on your T-shirt should be consistent with the messaging in your newsletter. Should be consistent with the messaging in your blogging. Should be consistent with the messaging that you want to get out to win this campaign. So media message is going to be very important. Some of our all of our regional chapters. We have 11 regional chapters. We ask that you have a rep that represents your group on the communications work group. And we call them SCAT reps, Strategic Communications Action Team. And that is a work group that anybody can join. But if you have a regional chapter, there ought to be at least 1 to 2 people specifically assigned to that work group, so that they can bring back to your local group what's going on nationally in communications and mentor you in creating your own communications. So I'm saying that to say that this is a column that the SCAT reps should be really involved in or interested in. The column with the targets, the red targets, would probably be a column that your policy rep would probably be really interested in or could be really helpful in. So again, we talk about our methods of how we talk about our strategies of eliminating stigma and changing policy and mobilizing our advocates. And then we talk about our methods. So we have work groups. Those are our methods that we participate in our work groups, so that we have the whole package. So I'm going to move to the next slide. Someone's asking, how do we identify the power we have over a target if they are not a part of the elected body? You strategize, you do research, you have meetings, you call PWM staff, we have policy experts who will help walk you through it. Camaria is asking that. There are ways that we can figure it out. I mean, you just dig and you Google and you dig. You may find, you never know what you may find. But sometimes, but we definitely have power over elected officials. But even if they're officials that are appointed, we still we can also consider like what their goals are. What do they plan on doing? Are they planning yet? Because a lot of that stuff is public. Are they planning on going for a specific position? We have the power to intervene and make it look as though they're not the person for that position. So we want to keep pressure on. That's our job as advocates, is just to keep pressure on. And I know one of my favorite sayings from Mahatma Gandhi, he says, first they ignore you. Then they laugh at you. Then they fight you. Then you win. So the reason why we have campaigns over time, because it gives you more opportunities to win. It's not a one-shot thing. It's not you just go out and do a protest or a rally. We have to be more strategic in that, knowing that we have to be so good that they can't ignore us. So the last column of the strategy chart is about tactics, and these are components of a strategy, right? So the actions that you take to pressure the target into making the decision that you want them to make in order to win your campaign, in order to win your issue. because in organizing, the issue is the answer. The issue is not the problem. In organizing, we want to win issue-based campaigns because we're not just coming with the problem. We're also providing you the recommendations or demands and saying this is what we think. This is what we think as a collective community. This is what we want to help. This will be a solution for us, and we've come to a collective solution. So we want to win our issues. We want to win our issue campaigns. And so our tactics have to be in context of what we're asking for. And I think we talked about this. They need to be directed at a specific target. You can't use the same tactic for every target. They have to be backed by a specific form of power. Whether you're calling that decision maker all day, that shows power. Whether you're letter writing, that shows power. Whether you're faxing that decision maker all day, that shows power. Whether you're showing up with a couple of busloads of folks, that also shows power. And your tactics could be anything from media events to public hearings. It could be rallies with lots of visuals so that you get a mainstream media there. You get the television cameras there. Sometimes you may have to do a civil disobedience. And that means just have somebody that may risk arrest. Because once you do that, you get all the cameras on you then. And then you get an opportunity to do what? To do this column before this, to do your sound bites. So you could have tactics that include just information sessions, voter education and registration, litigation. We can sue people, accountability sessions, right, and also elections. Great. Okay, so here we are back again at our bigger picture of our ending HIV criminalization strategy chart. And now we sort of fill some of that stuff into some of the stuff that we talked about in the last slide. You'll see now under goals, our long-term goal is to repeal HIV criminalization laws in our state. You may want to develop a toolkit. You may want to develop some basic information, a basic curriculum on how harmful the effects of HIV criminalization are. It's whatever you have the capacity to do, whatever you feel is going to make your case stronger. Your midterm goal could be to meet with top city officials, introduce HIV criminalization presentations at the local, state levels, at your ASOs, your CBOs, at your universities, at support groups. Okay, you could also submit your abstract proposals to conferences. At their local conferences, you could also submit proposals to local conferences. And again, your short-term goal could be something like establishing a meeting for a time, and again, educating stakeholders and educating your collaborators on the harmful impact that HIV criminalization has, especially on women and their families. Your organizational consideration: do you have a place to meet? You have internet, you have phones, you have a mailing address, can you print? So you want to go through your organizational considerations, then you have to make up a budget for what you don't have or what you suspect that you're going to be needing in the future. Are you going to have rallies? Are you going to need T-shirts? What is it you're going to need? Ways to strengthen your organization. You're going to be training trainers. You're training the trainers so that the people that you train can go out into the community and continue to educate the community, further disseminate the information. You're building leadership, and this is what PWM does. We build leadership. So when you look at your organizational considerations and want to understand how running a campaign can strengthen your organization, you're building leadership. And if imagine you have one person or two persons in charge of each of these columns. That's 12 new leaders that you're building leadership for within your group. That you have point persons. You have a point person for doing research, a couple of point persons for mailing, point persons for texting. So you build leadership. You meet people where they are, and you build leadership as you go. You become visible in the community, and again, you're putting that logo out there. your internal goals. You're going to be recruiting members. You're going to be building leadership, and you're going to be collaborating with other groups. So this is how this is what everything that we talked about in the last 5 or 6 slides, we've kind of put it here into this one slide. This is a living document. It doesn't stay this way. It changes. It grows. And every time you have a meeting, you can have this document. You can do it on the board. You can do it on butcher paper. You can have chalk and do this strategy chart on a chalkboard, whichever column you're working on a meeting that day. So this is and I said, you can start off with smaller details, but as you continue to grow your campaign, you'll become more specific about every item here. Okay. So just to review. Our PWM's policy issues. You could use this strategy chart to map out a campaign for ending HIV criminalization. We just did that. For achieving economic justice. What would that look like? A couple years ago, PWM South Carolina wanted to work on achieving economic justice, and they felt that it should look like getting a legislation that says ban the box on job applications, not to ask about people's prior criminal record on the job application, but to make sure that the person would actually get an interview, that they should take that question off of the application altogether, and the people should work on getting their records expunged. And that would be a way of achieving economic justice, because a lot of women shared that they wanted to get jobs, but when it came to the criminal background check, they weren't able to get it. So that was something that we saw that as a barrier to their economic justice. So again, these campaigns can look like anything that needs to happen in your local community, right? But you fit them under one of these 6 priorities, particularly if you're a PWM regional chapter. Securing women-centered care. We can use this strategy chart to map out a campaign. We can map out a campaign for promoting HIV prevention, justice, and care, right? And we just talked about that in Baton Rouge the other day. Achieving reproductive justice for women living with HIV. And that's just not women of childbearing, but all women at all of our ages being able to have our needs met. And ending violence against women living with HIV, and addressing trauma that we face. Many of us have trauma-related, PTSD. And we want to be able to have trauma-informed care. So ending violence against women and girls and addressing trauma could be something that you're asking for trauma-informed care on any assessment, any needs assessment, whether it's at an AIDS service organization, a community-based organization. Let's find out what happened. Not so much as is anyone hurting you now, but what happened. Let's talk about that trauma and make sure that the women are getting that kind of care that's going to be able to have them be able to address trauma, whether it's past trauma, and mostly it's a lot of past trauma. And many of us have gone through trauma timelines. So you know that we do have there is this definitely connection between trauma and HIV acquisition. Okay. So again, I hope you never get tired of seeing this. I hope you see this when you sleep. I hope you see this when you're awake, because this is a tool. This is a tool that we want you all to begin to develop, to learn, to use, to share, right? Because we can't keep things in our head, and it's going to be really important, because some people, they move into different positions, they move to different cities. And the campaign belongs to the group. It doesn't belong to one individual or 2 individuals. Only 2 people in the group knows what's going on. Here's the way. This is transparency. Everybody knows what's going on. Everybody can contribute. No matter what their level of education is, there's a column here that everybody in your organization can contribute to. It becomes a campaign of your group. It becomes a campaign of your community. And one thing I didn't mention under the media strategy is that at some point you're going to start to build a media list. You're going to start building a list of who are all the current reporters for the daily papers, for the radio, for the television. What's their phone number? What is their email address? You'll have a spreadsheet. So at some point you'll build this. You may want to call a press conference and call all of your media to this press conference. And then as you continue to work in the communications work group, you will learn ways to build relationships with media. At some point you'll have some just go-to media that you can just, whenever you need to have something covered, you can call on this particular outlet. So this is what it looks like when you start off. This is a blank strategy chart. It's a tool for your toolbox. It goes in the same box with your checklist for choosing an issue, with your strategy screen, right? It goes into your toolbox of campaign development tools. So here's where I'm going to ask you all to use your chat box. For those who are able to use your chat box, I want to hear from you, and let's see how we could just pretty much virtually build this campaign. Let's say achieving reproductive justice for women living with HIV, right? And anyone can chat in the chat box. So we're going to do the first column as far as goals. What would a long-term or mid-term or short-term goal be for a campaign, and what you want, and and the campaign or the priority issue PWM works on is achieving reproductive justice for women living with HIV. So I'm hoping that I'm not sure how to unmute folks. You can unmute yourself. If you want to unmute yourself, you can hit *6, and you can talk through this first column, or if you just want to make an entry into the chat box about this first column. What would some goals look like? Thank you. Someone in the short-term goals. Thank you, Stacy. Stacy says short-term goals would be to find those that are willing to advocate. Great. A great short-term goal, right? I need to go to Q&A mode. Okay. That's what my coworker just told me. I need to go to Q&A mode. I'm not sure how to go to Q&A mode. Could you give me some more information, Anita? Oh, okay. *6. Okay. So we have one short-term goal. What is the issue we're working on? We're working on reproductive justice rights. Reproductive justice for women living with HIV. Reproductive justice for women living with HIV. If anyone wants to talk about, we want to talk about just what would some goals look like. Short-term goals, long-term goals. We can schedule times to come together to the appropriate officials. Yeah, we're going to plan. We're going to plan on meeting with the appropriate officials. That could be a short-term goal. That is something we could plan to at least set the meeting up over the next 60 days. The meeting may not happen until 4 months, but over the next 60 days, let's call them, let's write them a letter, introduce ourselves to them. Yeah. Great. For reproductive justice, we need to define first what are we trying to achieve for the campaign. That's very good, Nana. And again, when we talked about earlier our PWM fact sheet, that's a good place to start. Is to familiarize yourself with our fact sheet. We have a fact sheet on every policy issue that we want to change. And so you want to do research. You want to be able to define just what it is you're trying to achieve. For example, expanding access to sexual reproductive health services at a particular clinic that serves people living with HIV, right? So, and Nana's writing in the chat box. So I'm sure that you can all see this, and I want to thank her for helping to work through this. But this is how you work through. This is how you work through the strategy chart, right? You can elect legislators who support our values. This is true, Sharon, and that could be a part of your overall goal or long-term goal. It could also be a tactic, right? Developing a strategy is what we want to do, right? And sometimes, like I said, if you have a group, each group, I think the overall goal column, everybody should probably work on together. But then each other column you could break down into groups, or you could work on one column each time you meet, or you could work on all the columns at the same time if you have enough people to divvy it up. But the idea is that you want to put the strategy down, you want to put it on paper, you want to make a visual of it, so that even if a new person, you invite a new person to come to the meeting, if you guys are talking over their head, they're not coming back. Yeah, they're not coming back. So once you bring someone in, to put them right where you are, if you put this, and you can use this strategy chart, if you have an LCD projector, you could put it up on the projector. You could put it up, and you could use a Google Doc to put it up. You could use a Word doc to put it up, or you could even use what I'm using here today as far as any meeting. But if you use a Word doc or if you use a Google Doc, you'll be able to you'll be able to type into the strategy chart in real time. If you all are statewide organizing and you're not in a place where you could all meet up together, you could all meet up on Google Docs, and this is a shared document. So you could still have the same conversation even though you're not in the same room together. Great. So yeah, so for the first column, we're talking about achieving women's in care. It could be having sexual reproductive health at the same clinic rather than you have to run all over town to be able to get those kind of services, right? And how about if let's go to the second column, and somebody names 3 internal goals for your group. So you have a chapter, you have a regional chapter, or you have a group, and you want to run this campaign. What are you hoping will happen for your group? How will you hope this will strengthen your group or your organization over this year? So let's say you're going to run it, but you have to put a time frame on it. You can't run it and we're going to do it until it's done, but you need to be able to mark your own victories. So if you put a time frame on it, that way you can see, well, we did have a meeting. We had a meeting at the 30-day mark, right? We collaborated with another reproductive justice health group at the 60-day mark. This way, you can mark your own victories as you go. So I would love to see somebody just tell me 1 or 2 internal goals for your group, from even running a campaign, from launching a campaign. How is your chapter going to benefit? What are going to be the benefits? What's it going to do for the women that are in your group? Is it going to make them disappear? Is it going to make them smarter? Is it going to give them more experience? Are they going to be engaging other leaders in the community? Those are the sort of organizational considerations, because you want to have internal considerations for your group, right? Gaining allies. Thank you. Gaining allies and new members. And it's okay to be specific about how many new members you want to gain in the next 6 months. Because, again, like I said, one thing about mapping on a strategy chart, you define your victory. You define your victory. We know we're asking for policy change, and we know that, policy concedes nothing without a demand, so they're not just going to give it to us, so we're in a fight. But how do we know that we're winning along the way, right? Because we're gaining allies and we're gaining new members, so we're getting stronger. Reproductive justice rights. Reproductive justice for women living with HIV is the campaign. Who will be our constituents? Reproductive justice for women living with HIV would be is our campaign. Who would be our constituents? Who will be our allies? Will we have any opponents, possible opponents? We probably have some opponents because people only think that we are sexual beings. You know what I'm saying? But our constituency are definitely ourselves, women living with HIV. We are the constituents. So we want to start thinking in terms of having this tool, using this tool, right? Other RJ groups could be our allies. Exactly. So we're using the tool right here, right now, in real time. If we were on a Google Doc, we could actually fill this in, and it will become a living document. And again, as we go, I think the next slide is going to give you a link to all of the webinar series, and where you can find even the webinar series on how to use Google Docs. We did that early. We did that last year. But we keep resources and fact sheets on our website for you all, and we just encourage you to be able to. We encourage you to continue to use them. Identifying a target for this campaign. Would it be the executive director of the organization? Would it be the head doctor of that clinic? Would it be the Ryan White Planning Council? Some people have AIDS activity coordinating offices. So you're going to identify who you're going to ask. Who you're going to ask to have sexual and reproductive health, integrated. Because that's one of the problems with reproductive justice for women living with HIV. Our sexual health and our reproductive health, they're like two different things. So we want to have our services integrated. So in North Carolina group, for our North Carolina group, Antoinetta. Oh, New York. I was going to say Antoinetta, you're from New York, but the New York group, we'll begin by educating women on how to become advocates. Second, we'll call our allies to support us. For our opposition, we'll educate them on the need to be a part of our campaign. That's really good, because that's what you're going to have to do. And you're going to do that by running a good communications campaign. Because if you run a really good communications campaign, you can bring people over to your side. People who weren't with you before, you can sway them if you appeal to their values. And that's going to be one of our, a webinar coming up in the middle of the month. I think it's May the 14th, values-based messaging. So Antoinetta has, Dreddy, you have a wonderful plan. I'm glad you're here on the call because I'm sure you'll be a very intricate part in helping the women in the chapter begin to use this tool. And we just talked about communication strategy. So, yeah, you may have to have a really good communication, a really good media strategy, because you may have to win some of these opponents over. And even if they don't decide to follow you, at least they will no longer oppose you, you know. So that's just as good, right? And then what kind of tactics would you use to show your power to the target? Okay, something just happened with my, there was an issue with this process. Let's see what happened here. I beg your pardon, but I was just cut off the webinar. So I'm gonna make sure that I get back on. I'm not sure how that happened, but I'm gonna get back on and get back with you all in just a minute. Great. Okay, so I apologize for that, but I'm still here. And again, young you said stay tuned for more details about the value-based messaging, which is going to be May the 25th. The time's going to be announced. So, but the takeaway message from this slide is that you have this tool where you can be very specific. You have this tool because what we don't want to do is we don't want to start our campaign all the way over here in the yellow column. We don't start a campaign with tactics. We start a campaign with planning, what the goals are. We start a campaign with the researching the issue, and finding out what impact is this issue having on women living with HIV. What are the recommendations? So I just want to make sure that you understand that, if there happens to be a rally, it's because the rally is a tactic, not because the rally is the campaign. Great. Antoinetta just gave us some good news about some funding that she got. We're going to talk about that. Great. So we're going to move to the next slide. We don't have much time left, but I'm hoping that you found this exercise sort of helpful in helping you be able to actually use this tool. This is not because I showed you the versions that were already filled in, but this is a working document. It's a living document that any of us can be able to use in our advocacy. So this is the fourth regional organizing webinar in our 2016 campaign development series. We wanted to see campaigns developed in the region. We wanted to highlight those campaigns when we get to the summit. And so we've been consistently giving you materials and tools since January, and hoping that you understand that this is a package, that this is a series, and so inviting you to go back and to go on the website and to go back and you print these out. You can go over them together as a group, or you can hit a link. You can listen to them, but they're all able to be printable. So in January we did internalizing PWM priorities to human rights gender lens. In February, who are advocates? What's a campaign? Non-disclosure, not a problem. March, choosing a good campaign issue. How to choose which campaign you're going to run. And today we did mapping and building campaigns using the strategy chart. So again, this link will also take you to the policy series where we just did a PWM Policy 101, identifying the players in the process of how a bill gets passed. This link will also take you to Securing the Future of Women-Centered Care, to the findings from the community-based research report from the Ryan Wright report. right? And the communication series, Our Story, Our Message, which was just done the end of March, defining our personal narrative and using it to frame our message. And in fact, if you go to this link, you can go to webinars that go back as far as 2014. You will see webinars that, because we're beginning to record all of our webinars so we can so they will be accessible to our community. And I just talked about this, the upcoming webinar, Value-Based Messaging, May 25th. Be there, be square. We're hoping that you all plan to be on this webinar. This will be a combination of the regional work group, the communications work group, and the policy work group. We're going to do this webinar together. And if you pre-registered, I'm a good advocate for pre-register because it gives you automatic reminders. It'll give you automatic reminders. And I encourage you to view webinars with other women who may not have access to the technology, who may not understand the technology. And again, please review the webinar materials in your local chapters. I hope this is a priority for local chapters. In the past, we've given the first two webinars, we gave group homework assignments in, and you all did really good turning those homework assignments in. Very, very impressive, very engaging. But here's the thing, campaign development has to be on your agendas. When you have your general meeting, even when you have your meetings with your core group, with your core members, you all should take time to make sure that you have campaign development on your agendas. When you're having your leadership trainings, and that's the big meeting that you have with the general membership, this has to be a part of your agenda. You have to allow everybody to help be a part of filling out the strategy chart and becoming a part of the win. We don't want this to be a win for a few folks. We want you to win this as a group. And so this is the end of our webinar, and I'll ask here, are there any questions, comments, concerns? So attendees chat is public to everyone. I'm still not sure. I think if you guys hit *6, that you all can talk. I apologize if I can't get you all talking, but we can certainly use this strategy chart. Thank you, Eva. I'm glad that you enjoyed the information. I'm glad you enjoyed the guidelines. But we have time, and as a reminder, there is a short survey right after this webinar. As we end this webinar, you will be taken directly to a survey, just a few questions. We want to make sure that we're giving you information in ways that you can uptake it, and that the information that we're giving you is relevant to where you are in your advocacy. They can't unmute unless I put us in Q&A mode. Thank you, Sarah. I'm glad you all joined. Q&A mode. Chat history. Great. How many folks are planning on using the campaign strategy chart? Good question, Nana. That's actually one of the questions in the survey. Good question. Before our time is up, we have about 12 minutes. Thank you, Asha. Asha appreciates the graphics here. And the next time I come on here and have a webinar with you all, I'm going to know how to let you all talk. Yeah, I know that you all know that I like to talk, but I don't like to talk this much. I'm sort of like afraid to touch anything that I don't want to put the chat lines in the trash. I see I can mute the chat boxes, but I'm just not seeing where I could actually unmute the attendees. Thank you. The Kamaria is going to be using thank you. Yeah, we're going to see everybody in Huntsville, Alabama, and I'll be sure to bring some blank strategy charts with me, so that you can all take them back. And again, like I said, we will make this presentation available to you. We will make this available to you, and everyone will be able to have copies of this. Okay. Okay, Arnita's asking me to look at the top controls. I just clicked off everything. I see a trash can, Arnita, and then I see a figure. I click that on. I see a bell. I click that on. So why don't you try unmuting yourself and see if you can chat with me. Great. Thank you, Sherry. Sherry says she definitely wants to get the women used to using these charts. I appreciate that. Oh, it's under interact. Okay. Yes, this is chat, Sherry. We're still under chatting. So we have about 10 minutes left. I think we're going to go ahead and end the webinar so that you all can go to the survey. You can go to the survey and do the survey, and please be honest about what you thought about the information. And I appreciate all of you coming on. We had at least 20 members on the call. Then we had people on the phones. We had people on the phones, people on their computers, and I'm going to go take me a class on how to run this webinar. So I just want to say thank you to everyone, and enjoy the rest of your day, and get those campaigns going. And PWM staff is here. No one has to do, we got your back. No one has to do anything by themselves. Know that we're all available for you. Doesn't matter which work group you're in. We're all available for you to help you develop your campaigns. So please continue to use the tools that we give you. Review the webinars that we've made available to you on the website. Review the fact sheets. They're there for you. And do take care of yourself. Thank you very much. Everybody have a great day.